more complicated place in the world to be sick than America.
No, it's very difficult here in this country to, again, have multiple conditions, manage them successfully, and be able to maintain the totality of the experiences you want in your life. And the reason we chose Healing Lives Together, healing is not just clinical. Yes, we are going to attempt to, as Erica said, help with the chronic conditions you'll likely carry for, if not all, most of your life. But we also want to help you heal from some of the experiences that may have been a product of carrying those things. Help you, for instance, make sure you're mobile during the holidays when you finally get to see your family. Make sure that if you had something negative happen to you in your past that you're still working through, that we're helping you get to the place where you do feel healed. Can we cure everything? Absolutely not. But I think healing is a very worthy endeavor, and that's why we chose Healing Lives Together as our mission.
One of the things I think too is, while you were looking down the road and you are looking down the road, I don't know that if we really could have predicted even, 10 months ago, how much complex mental health claims were going to come into play. And one of the things that we've been talking about within Lockton and our own complex claims team is the sheer number that we have seen since mid of 2020. And while all of our numbers aren't really fixed yet and not something that we've necessarily publicized, it falls on the top list of what we look at as expenses, but also very short on solutions to help somebody with complex mental health, because we're talking about, kind of to one of your earlier points, not just about someone who's perhaps diabetic and suffering from depression, but really severe mental health needs that are usually combined with perhaps addiction or some other multi-diagnosis. So is there something specifically, with your model and with your providers that you are really thinking about, how can we help this subset?
Yeah. So we call the entirety of our care team a care circle. And the reason that we actually chose to employ all of them was we felt it was absolutely critical that they all work collaboratively together. So if you think about either an employer experience or someone who's working with a health system right now, or a set of health systems, on the employer side, yes, you may have a diabetes solution, you may use something like a Talkspace, you may have other solutions. They are likely not working with one another. They are solving for the one thing they have been deployed for, which is really not focused on the totality of that patient's needs. And as I said earlier in my example, if you're someone who's navigating multiple specialists, pharmacists, et cetera, in the healthcare system, my guess is they aren't talking to each other either. So we felt it was absolutely critical to staff all of them on our side, make sure they were sharing the same set of information, the same EMRs, and that they were obsessed with the same patients, 24/7, 365. And I think that's where we're different. I think it is fair to say, in the commercial space, there is no one out there like us. There are a lot of point solutions. There are a lot of things that are seeking to solve for one condition. But we are the first to say, bring us the whole patient. We will manage the entirety of their experience.